Hello everyone, I'm Dr. Divya Madan. Today we are going to discuss about infantile tremor syndrome. The name itself has three components: infantile, tremor, and syndrome. Infantile indicating that this is mostly seen in infantile population, that is less than 1 year of age population. Tremor, you need to understand what this tremor is. This is an abnormal movement, and how do you define tremor? This is a rhythmic oscillatory movement that involves your limbs, right? It can involve your head having a fixed frequency, and it usually involves antagonistic muscles, right? That means it will involve flexor also, extensor also. Both the components will be involved. It is a rhythmic movement, oscillatory movement. It can involve limbs, it can involve head, and it has a fixed frequency, right? Now, coming on to the classification of tremors, they can be fast tremors, intermediate tremors, and slow tremors, and this is because based on the frequency of the movement, right? If the tremors, the oscillatory movement is too fast, that is more than 7 per second, more than 7 hertz, that would be a fast tremor. 4 to 7 hertz would be an intermediate tremor, and less than 4 hertz would be a slow tremor. So we know now infantile tremor syndrome, a syndrome that is seen in less than 1 year of population mostly. It involves tremors that are rhythmic oscillatory movements having a fixed frequency involving antagonistic muscles. And we also know there are three types of tremors, that is fast, intermediate, and slow. And this classification is based on the frequency. If the frequency is more than 7 hertz, it is fast, intermediate is 4 to 7 hertz, and less than 4 hertz, it's slow. Right? Now, coming on to the definition per se of an infantile tremor syndrome, where do we classify this syndrome? So this is a group of very poorly understood tremor and developmental disorder, right? It is not just a movement disorder, it is also a developmental disorder. Coming on to the etiology, of this syndrome is largely unknown, and various hypotheses have been made and various associations are there, right? Various case series and case studies are there. So mostly it is associated with poor socioeconomic status and exclusively breastfed infants that are not weaned properly after 6 months of age, right? And also certain nutrients deficiency are also implicated in the pathology. For example, vitamin B12, zinc, iron, magnesium, various micronutrient deficiencies have been documented, and the strongest association is seen with vitamin B12 deficiency. And also it is thought that there is the possible involvement of the extrapyramidal system because of the tremors involved, right? And the most common age group, as we had discussed it earlier, is infantile age group. The range is 6 to 18 months. Coming on to the gender predilection, there is no specific gender predilection, but in some studies there is shown that males are afflicted more than females. Now, coming on to the clinical feature, you must have seen it in your pediatric wards. A lot of patients, malnourished patients, coming with this tremors and apathy, listlessness. So, the most important clinical feature in infantile tremor syndrome is the mental changes that includes listlessness or apathic. You will see a apathic child with delayed milestones or either regression of milestones, and it begins at 6 to 8 months of age. And this stage where only mental changes are seen and tremors are not seen at this stage, this is also known as pre-tremor stage or pre-ITS stage, right? And the hallmark of the syndrome is tremors, and the tremors seen in infantile tremor syndrome, they are coarse tremors with a frequency of more than 7 hertz. That means they are fast tremors, right? And the peculiar thing about these tremors is they are only seen in the awake state. When the child is sleeping, they're not seen, and it occurs in distal limbs, tongue, and sometimes head. You can see tossing of the head from side to side, and in some cases it can involve laryngeal muscles. So at that point of time, if the child cries or tries to speak, there will be a difficulty, and the cry would be like that of a seal or a goat giving out a sound, right? So a specific term have been mentioned, that is bleat like a goat, right? So if the tremors involve laryngeal muscles, there will be difficulty in speech and the child will bleat like a goat. The other features that are associated with infantile tremor syndrome are pallor, hepatosplenomegaly, only hepatomegaly. The peculiar physical finding that is seen in ITS patients is hyperpigmentation. You will classically seen hyperpigmentation of knuckles, right? Even in the mother of that child, you can see the same. There would be hyperpigmentation of knuckles, and over the body there can be a diffuse honeycomb or reticulate pigmentation. Hair of that child would be classically of that you will see in a malnourished child. There will be very brittle hair, easily pluckable hair, very sparse hair, depigmented hair, and in the later life there can be an abnormal hand posturing. This hand posturing will be like similar to those that like a bird is going to take a flight. Again, a term given here to explain the symptom, express the symptom. In later life, it can be seen the posture of the hands would be like the bird is going to take a flight, right? So ultimately, because the etiology is unknown, we don't have a per se diagnostic test. It is a clinical diagnosis. You'll see mental changes, you'll see classical tremors, you'll see signs of vitamin deficiency, including hyperpigmentation of knuckles, sparse hair, depigmented hair, brittle hair, easily pluckable hair, and you'll do routine investigations to see whether the child has anemia or any specific nutrient deficiencies. In more than 80% of cases, the child will be having anemia of some sort, and in 70 to 80% cases, the PBF, that is a peripheral blood film, would see macrocytosis, macrocytic anemia, and if you go for B12 levels, mostly they are decreased in infants and females that are feeding that infant. And on neuroimaging, you will see cerebral atrophy in long-standing cases. The treatment of this ITS is supportive. You will supplement the child nutritionally, give B12 supplements, and for the tremors, they usually respond to low-dose propranolol. That's it for today's video.